It's a Tuesday in 1949. You're 34 years old, a housewife in suburban Ohio, and your husband has driven you to the doctor because you've been crying too much. The doctor doesn't put you to sleep. He gives you 3 electric shocks until you go unconscious, lifts your left eyelid, and slides a thin metal pick, shaped like the one in your kitchen drawer, into the corner of your eye socket. He taps it with a small hammer until it punches through the bone. Then he sweeps it back and forth. You'll be home in time to make dinner. This is the transorbital lobotomy, and in the 1940s and 50s, American doctors performed it on tens of thousands of women, most of them housewives, for the crime of being unhappy. To understand how we got here, you have to start in Lisbon in 1935. A Portuguese neurologist named Antonio Egas Moniz had been to a conference in London. He had watched a presentation about a chimpanzee named Becky, whose frontal lobes had been surgically disconnected. Before the surgery, Becky had been frustrated and aggressive. After the surgery, Becky was calm. Moniz went home and thought, what if you did that to a person? Moniz called the operation the prefrontal leucotomy, white cutting. He drilled 2 holes in the patient's skull, slid in a thin wire loop called a leucotome, and severed the connections between the frontal lobes and the rest of the brain. He performed the first one in November 1935 on a woman with depression. He claimed she improved. He never followed up on her long enough to know. In 1949, the Nobel Prize Committee gave Moniz the Nobel Prize in Medicine for his contribution to psychiatry. The same year, on the other side of the Atlantic, an American doctor was already making the procedure 10 times worse. His name was Walter Freeman. He was a neurologist at George Washington University. He had no surgical training. He had never been a surgeon. He thought the leucotomy was a brilliant idea, but he had a problem. It required a real operating room, a real surgeon, and real anesthesia. It was slow. It was expensive. It cured maybe 1 patient a week. Freeman wanted to do it on assembly lines, so he went into his kitchen, pulled an ice pick out of the drawer, and started practicing on grapefruits. He realized you didn't need to drill the skull at all. You could go in through the eye socket. The bone at the back of the eye socket, the roof of the orbit, is paper thin. Tap it with a hammer, and it gives. He had his neurosurgical partner, James Watts, refine a slightly fancier version of the ice pick. He called it the orbitoclast. It was an ice pick. Freeman called the new procedure the transorbital lobotomy. By 1946, he was performing it without anesthesia. He used electroshock to knock the patient out instead. 3 jolts of electricity, enough to cause a seizure and unconsciousness. Then the ice pick. Then the hammer. Then the sweep. The whole thing took about 10 minutes. He didn't wear gloves. He didn't wear a mask. He did it in his office. He did it in front of cameras. He once did 25 women in a single day. He took the show on the road. He bought a station wagon, painted it, and called it the Lobotomobile. He drove it across America, visiting state asylums where he would lobotomize patients in hallways, in doctors' lounges, in staff cafeterias. He charged $25 a head. By 1951, he was the most famous psychiatrist in America. Life magazine called him a miracle worker. The New York Times ran glowing profiles. Saturday Evening Post put him on the cover, and now we have to talk about who he did it to. Between 1936 and the late 1950s, about 40 to 50,000 lobotomies were performed in the United States. Roughly 60% of those patients were women. This is the number that should stop you, because in the same period, men outnumbered women in American state psychiatric hospitals. There were more male patients. There were more male diagnoses of severe mental illness. There were more men institutionalized for schizophrenia, the original target of the procedure. And yet 60% of the people who had their frontal lobes cut were women. The diagnoses tell you why. Women were lobotomized for depression, for anxiety, for what doctors called nervousness, for postpartum reactions, for menopause, for arguing with their husbands, for sexual desire that was considered excessive, for sexual desire that was considered absent, for not keeping the house clean, for keeping the house too clean. One of Freeman's patients was lobotomized because she complained too much about her mother-in-law. Another because she didn't want children. The medical records, when you read them now, sound like complaints about a roommate. Difficult, moody, unsatisfactory. The most famous of these patients was Rosemary Kennedy. She was 23 years old in 1941, the eldest daughter of Joseph and Rose Kennedy, sister to the future president. She had mild learning difficulties and what we would now call mood swings. She wanted to sneak out at night. Her father was worried she would embarrass the family. Without telling her mother, Joseph Kennedy arranged a lobotomy with Walter Freeman and James Watts. They cut into her brain while she was awake. They asked her to sing songs and recite the Lord's Prayer. They cut until she stopped speaking. She never spoke normally again. She could not walk. She could not feed herself. She spent the next 64 years in an institution in Wisconsin. Her family did not visit for 2 decades. She died in 2005. Here is what the operation actually did. The frontal lobes are not where you keep your symptoms. They are where you keep your initiative, your judgment, your sense of future, your ability to start things. When Freeman cut those connections, the depression often did get quieter. So did everything else. Survivors were described by their families as flat, blank, childlike. They would sit in a chair for 10 hours if nobody told them to get up. They could not plan a meal. They could not feel embarrassed. Their personalities, as one daughter put it, had been turned off. Some died on the table. Estimates range from 1 in 20 to 1 in 25. Many had seizures for the rest of their lives. Some became permanently incontinent. Many became docile in exactly the way their husbands had wanted. And that was the quiet logic of the whole thing. A 1947 paper celebrated that lobotomy made women into better wives. A psychiatrist writing in the American Journal of Psychiatry observed that lobotomized housewives could now perform domestic duties without complaint. A husband, interviewed for a 1949 news article, said the operation had given him back his wife. Only better, because she no longer argued. In 1954, the FDA approved a drug called chlorpromazine, brand name Thorazine. It quieted patients without surgery. It cost less. It came in a pill. Within a decade, lobotomies in America dropped to almost 0. Walter Freeman performed his last one in February 1967. The patient, a woman named Helen Mortensen, whom he had already lobotomized twice before, died on the table from a brain hemorrhage. He was banned from practice. He spent his final years driving around the country in a camper, visiting his former patients, photographing them, keeping notes. He died in 1972. In 1977, the United States Congress held hearings on psychosurgery. They concluded that the lobotomy had no scientific basis. The Nobel Prize awarded to Moniz has never been rescinded. The medical community has never formally apologized. The names of most of the people who were lobotomized were never recorded. State hospitals destroyed the files. We talk about the lobotomy now as if it were a medieval mistake, something done in the Dark Ages. But the women who survived it were still alive in the 1990s. Some are still alive today. The procedure was performed in the same decade that built the interstate highway system, that landed on the moon, that invented the polio vaccine. It was not pre-scientific. It was not pre-modern. It was modern medicine, doing what modern medicine has always done when it cannot cure something it does not understand. It found a way to make the problem quieter. The problem, for 20 years in this country, was a woman who would not stop crying. And the solution was to cut the part of her brain that knew how to want anything at all.